Now, the #1 story of the week, the Department of Veterans Affairs will do a strategic review of its Electronic Health Record Modernization program. The top-to-tail review of the $16 billion system will take up to 3 months. Dr. Jennifer MacDonald is Chief Consultant to the Deputy Undersecretary for Health at the Department of Veterans Affairs. Dr. MacDonald, welcome. Thanks for coming on the program. What caused Secretary McDonough to want to take this review, and what exactly will the VA review during it?
Well, thank you, Francis. It's great to be with you. The electronic health record implementation is yet another example of VA's leadership on behalf of veterans. It's essential that we get this right to deliver the lifetime world-class care that veterans have earned and expect from VA. And this is the Secretary giving VA the opportunity to take a look at the productivity at our first implementation site, take a look at the clinical workflows, how we engage with patients and how their care teams support them, and also make sure that in the patient portal, that veterans are getting everything they need and desire from the interaction with our technology and their ability to access their medical records.
To that point, Dr. MacDonald, the issue apparently from accounts is that in the deployment at Man Grandstaff in Spokane, Washington, there were some issues that both the healthcare providers and the veterans, the customers of this system, presented. Which is the main issue there, if there is a main issue, and how would you go about addressing that in this review, ma'am?
Well, Francis, we're listening intently to both. Certainly the feedback from the diverse complement of veterans we serve and their families and caregivers and survivors are critically important to the way we shape the way forward. We're also intently listening to the very dedicated leaders and employees who, even in the midst of a pandemic, led this transformation effort forward at our Man Grandstaff site. We're listening to both. And really what's important, Francis, is that patient-provider relationship. I'm an Army veteran and a family doctor, and I practice within our system, and that ability to make sure the technology serves that relationship and really furthers the ability for patients to tell us what they need and for the clinicians caring for them to serve them is what we're after here. We want to get this right such that this site can really be the champion site for the rest of those across the nation.
Do you have any sense yet, Dr. MacDonald, of whether this is a hardware or software problem, something infrastructure-wise? Is this an issue with training for either educating the healthcare providers how to use the system or the veterans, the customers, how to use it? Something else? Don't know yet? Where does that stand, Dr. MacDonald?
Well, these endeavors, implementing an electronic health record anywhere, including outside of VA, is always a complex endeavor, and it's always a range of factors. And it really comes down to, again, that patient and provider interaction. I want to be clear that this is not a performance-based review. Our vendor, Cerner, did not cause this review. VA is conducting this strategic review proactively to go on no longer than 12 weeks to make sure that we're doing this with excellence and living our iCare values, really listening to the veterans and the employees in our system and making sure that the technology nuances and the way that those play out in a veteran's care journey are addressed and really optimized such that we are delivering that excellence and experience that is expected from VA, and that we really are setting a tone of leadership in this space. We'd like to continue to be the premier integrated healthcare system in the nation, and this is one way that we lead forward.
FedScoop reported this week, ma'am, that the plan to roll out the system next in Columbus, Ohio is still on track, but schedule changes are on the table following the review. How will you evaluate how you want to move forward with this based on this review, Dr. MacDonald?
We will be taking a hard look at that schedule for Columbus and for the sites following on to Columbus. That certainly is a part of the strategic review. And again, this comes down to making sure that we've listened to the veterans and the really dedicated leaders and employees in Spokane, and that we've addressed all of their concerns and make sure that this system is premier such that they can be the champions for the sites going forward. We want our employees in Spokane to feel so confident in this system that they are proud to see their colleagues in Columbus and across the rest of the system go live with this, and that, again, that VA leads the way forward here.
One of the major advantages of this system, ma'am, is that originally it was designed to merge with the Department of Defense's military health system, Electronic Health Records, something that Vista couldn't do. Is there any implication in this review for that interaction, or is that a separate issue, ma'am?
The implication is actually strengthening that relationship and that engagement. We are deeply grateful for our Department of Defense partners who are engaged with us daily in these efforts and making sure that we move this forward jointly. The promise here, the promise of realizing a unified record across the Department of Defense and the Department of Veterans Affairs is coming at this as a clinician and an executive here in VA is enormous. From a population health perspective, from a benefit of experience to individual veterans, and from a joy in work perspective for the employees and leaders in our system, the potential here is enormous, and that partnership with DoD is critical. We're grateful that they engage with us each day.
Dr. MacDonald, how will you measure the results of this review? What's a success for this review 12 weeks out from now?
Well, it's a great question. And again, it comes down to listening. When veterans are telling us that this is the experience that they're happy with, when our employees are saying, yes, this is exactly what allows me to do my job well and serve. And when we, from a management perspective, see that the productivity, the clinical workflows, and the patient portal elements are where we want them to be, then those will be our measures of success, and we'll be able to proceed forward.
We have about 30 seconds left, Dr. MacDonald. Do you think your background as a clinician gives you some extra insight that maybe only technology people or only management people or so on that might be involved with this review don't have?
Well, I'm certainly grateful to be serving in this system, in this role, and as a clinician, but I think it takes the whole interdisciplinary team, Francis, and that's how we're approaching this. As one unified team, this is the clinicians alongside the technologists, alongside the logisticians, alongside the operators, and most importantly, alongside veterans, really putting them first and listening. It takes all of us to get this right. We're committed to doing so, and we certainly will.
Dr. MacDonald, thanks very much for joining me today. I appreciate your time, ma'am.
Thank you for your time.